Patients who have chronic wounds that just won't heal may feel discouraged and wonder if they will ever get better. Well, East Jefferson General Hospital can fix that. In today's Medical Moment, see how the Wound Care and Hyperbaric Medicine Center at East Jefferson is changing lives.
So imagine that you have a wound, a cut, or a burn that simply will not heal. Well, maybe if that's the case, hyperbaric treatment is for you. A lot of doctors and experts are telling us that the results here are nothing less than miraculous. Dr. R Arencibia is a physician here at East Jefferson General Hospital, and he tells us all about the amazing results after having this treatment.
Typical people who benefit from this are people who've got diabetic foot wounds or diabetic wounds in general from a certain stage, people who have bone infections, people who have radiation injuries that include something called hemorrhagic cystitis, which is cancer effects, late cancer effects with radiation to the bladder, to the colon, or to certain areas of the skin.
And so what kind of results do you see with those cases?
Unbelievable results, especially with radiation. It's essentially the only thing that cures those kind of conditions. As far as diabetic wounds, when we have the right environment where their diabetes is controlled, they're not smoking, and we're not putting any pressure on those wounds, we also have excellent results. So
let's talk about the actual experience. We walk in the door as a patient, and then what happens?
A day in the life of hyperbarics. We have excellent hyperbaric techs that we employ here, and they walk them through a very strict and stringent checklist. It's kind of almost like a military operation. You have to be here on time. You have to wear certain clothing. There's certain things that you can and cannot do when you go in the chamber. Essentially, when you come in, we'll check your vital signs and have you change into our scrubs, and then get you settled into the bed and wheel you in. And it's as simple as that. And then you spend about 2 hours in the chamber just watching TV or sleeping or snoozing, and it's almost like a spa treatment.
So it's all very interesting. It looks like it could be very scary, but you say it's like being in an airplane, right?
It may look intimidating, but it's really not. It feels sort of like you're in an airplane. An airplane is a hyperbaric chamber in itself, and when you're getting a treatment, it sort of has that same feel.
So the big question, of course, is how does all of this work?
What happens is, with the increased amount of oxygen and pressure, it sort of pushes that oxygen to areas of the body that don't have access to oxygen.
Okay, and we have a patient in here. What would happen when somebody's in here? Why would someone be in the hyperbaric chambers?
The reason we put them in the chamber is to change the environment that they're in. Typically, at sea level, we breathe 21% oxygen at 1 atmosphere, the amount of pressure that we receive as far as our body's concerned. The atmosphere or the environment we put them in the chamber is essentially having them down about 33 feet underwater, breathing 100% oxygen.
Jim, it's such a pleasure to meet you.
Thank you.
And here we are in this treatment center. How did you end up here?
I went to see one of my doctors who I'm a prostate cancer survivor, and I had prostatitis where I do a lot of bleeding in the bladder, and he fixed it. So to repair it, I had to come here to do hyperbaric treatment.
Okay, and so then you got here, and what happened? Talk us through that process.
I got here, and the second I got here, everybody treated me like I was family that I haven't seen in a long time. They were very good. They were very kind, and they comforted me, and they ran me through every step of what's going to happen. And it was very comfortable. 2 years I was catheterized off and on. And after about 25 days of hyperbaric treatment, I am catheter free. I am actually on my own. I'm doing whatever I need to do.
Have you referred this to anybody? Do you talk about this?
I do. Matter of fact, a lot of people have asked me about it, and I told them that they need to see their physician or come up here and ask about it.
Your story is very amazing. Are you shocked by your story?
Yes, I am. 100% turnaround, 100%.
So let's say I have a wound. I'm sitting at home, I notice wounds on my skin or somewhere on my body. Can I come in on my own, or do I have to be referred here?
So if you're wondering if hyperbarics is good for you, or you think that it might help your particular condition, first you can just call us. We're able to field questions about whether it is appropriate or not. There is a subset of conditions that we do treat and that we think are appropriate. Otherwise, you can come in for a consultation. But typically, if you have a wound, you should definitely see us regardless, because this is just an adjunct to what we do in the wound clinic. Other than that, if you have any radiation wounds, you definitely should see us for this.
Let's talk about that just a little bit. What type of wounds? I mean, can you bring yourself here, or do you have to be referred here? So if I'm at home and I have a wound, can I just come?
Both ways. We have tons of patients that actually self-refer themselves now.
One thing you mentioned I thought was interesting is that hyperbaric treatment is established science, but really it's leaps and bounds beyond that, right?
I'll give you an example. Bo Jackson with a particular condition called avascular necrosis. That's something that the only option you had was to have a hip replacement, and now with certain levels of that type of degree of injury, hyperbarics can actually cure that process. Many universities are using this on their students. Football players use it as well for recovery. LeBron James uses a subatmospheric hyperbaric chamber after every game to help him regenerate, some of the muscle damage that he's had. These are all cutting-edge treatments that we're now looking into as far as that's concerned.
So again, while this may look a little scary, the results are simply miraculous. We are seeing amazing outcomes and life-changing results. If you feel like hyperbaric treatment may be something for you, it's very simple. Just pick up the phone and call 835-4919.
Thank you, Camille. Remember, you can always visit EJGH.org for more information about hyperbaric chamber treatment and East Jefferson General Hospital.